I thought the first thing that I do is acknowledge the fact that the audience of this webinar includes researchers and practitioners, and so I sort of understand that the idea of thinking in frameworks may not be things people explicitly think that they do, but frankly we all do think in frameworks, and it's important for us to, I think, acknowledge what frameworks guide our thinking, and to be very clear about what exactly they are and what they contain. And often, I know people sort of think that the line is between those who use frameworks and those who don't. But I think the truth is that the line that separates people is between those who acknowledge explicitly that they use frameworks and those who don't. And frameworks are particularly important because they identify the different variables that we need to consider when we are analyzing issues. In this context, issues that affect health systems. They make assumptions about these variables and how they are connected to one another. And in many instances, what frameworks do is that they help us guide our inquiry, whether it is that we are trying to intervene in a system or whether it is that we are trying to define research questions that we need to answer. And far more important, and I think particularly important for this session, is the fact that frameworks give us a language with which to communicate about a common issue, and they sort of provide a starting point, often for debates and for understanding one another. And when I think of health system governance as a sort of subfield under health systems or health policy and systems research and practice, I often wonder whether we can truly define ourselves as a discipline. If we define a discipline as a field where people share the same assumptions and engage in arguments about how to build on those assumptions. I'm not sure that we are very clear as yet about what assumptions we have about what governance is. And of course, like Miriam mentioned at the beginning, the health system building blocks have given us a language for about a decade to talk about health systems and health system strengthening and related issues. But I think that those building blocks have also done a disservice, in particular to the issue of governance. Because I often get this impression that those of us who talk about governance are like the proverbial two ships that pass in the night. We seem to mean ever so slightly different things by governance. And to advance the field in terms of practice and also in terms of research, we need to develop a common language or a common set of understandings about what governance really is. We don't have to agree, and it's not. I don't think that the point of looking for a language and common understanding is to agree. Not as much as agree, as much as to be able to talk to one another and debate one another about things we disagree. The least we must expect of a framework is that they fulfill the test of reality. In other words, do the frameworks that we use truly and accurately reflect the reality of the phenomenon that they seek to capture. And one of my early challenges with the health system building blocks was the idea that I couldn't find community in them. I couldn't find people in them. And if you work in a low and middle income country health system like I do, and when I was working particularly in Nigeria, I noticed a very interesting phenomenon in which a lot of what determines the demand and supply of primary health care in the community is the level of engagement and the level of action that the people at the community level themselves develop. And I couldn't sort of figure out how the building blocks helped me think about that. And other problems that I've noticed about the building blocks framework of governance over the years have been that they tend to be static, while governance, like the other building blocks for that matter, in reality are dynamic. They don't tell us very much about how and why systems are the way they are. They don't provide us with the idea of how these supposed building blocks are interconnected with one another, such that they can allow us to actually then ask questions about which connections are not working or which connections are suboptimal. And perhaps also more important is that they don't suggest any theory, again because they don't specify sort of connections between the building blocks. So we can't again use them very much in thinking. The most that I think we've been able to use them for is to identify sort of categories, and that is not, in my opinion, the most important thing the framework should do. And here on this slide are sort of 6 different iterations of the health system building blocks, and I'm sure several of them are familiar. Some of them are part of an effort by some people, Jeffrey Lazarus and French, about 3 years ago with Health Systems Global, trying to find a way to improve, I suppose, the building blocks. And the common theme that runs through all these efforts at improving the building blocks is that they are looking for a place to fit people. And they're also looking for how to acknowledge and account for the fact that governance seems to be a bit different. And really, you can't move ahead, in my opinion, in using these building blocks to think as long as you think that governance is a building block. And we, I think, need to liberate governance from these building blocks and make a better sense of it. And my thinking, my suggestion is that we think of governance as a mortar, right, that holds the building blocks together rather than a building block itself. And I think if we begin to think of mortar, of governance as mortar, which determines how the building blocks are aligned, whether the building blocks exist at all in the first place, how the building blocks function, how strong they are, how well they can withstand impact and stress, then I think the metaphor of building blocks will begin to make more sense in terms of helping us to think through what is in a health system and how to think about and study health systems. Now, to step back a couple of steps and think through exactly what the word governance means. So the origin of the word itself is from classical Greek for a word that I struggle to pronounce, but I think it's kibnan, which means to steer a ship. And Plato famously used the word in that sense when he referred to steering the ship of state, again, which means governing. And I often like to highlight that the word governance does not mean government. It's not synonymous with government. Anyone whose actions, decisions, and relations determine how a system functions or a jurisdiction functions is involved in governance. Essentially, we are all in different roles and positions and enacting different activities involved in governance. As long as we steer how the system performs or how health services are delivered, in fact, all demand and supply side actors, including community groups, like I mentioned earlier, are governance actors. They are involved in governing a system. The building blocks framework, if you read the WHO document in 2007, seems to think of governance particularly in terms of government and sort of what governments do, and frames it very much in terms of the stewardship role of government, which is absolutely fine and is central, but governance goes way beyond that. And in trying to fit in sort of this thinking of this diffuse nature of governance into how to think about health systems, I found the framework, Institutional Analysis and Development Framework by Elinor Ostrom and her colleagues, very useful. And their framework was initially used to think through the governance of common pool resources, so resources that are owned by people in the community and that who are taxed, often to ensure that it's well governed, to ensure sustainability. So it's a governance framework that acknowledges the role of people and also the interrelations among them. And I find it very useful in thinking through how the health system is governed. So let's break down the word institution. There's a lot of debate about the word, but I'll adopt sort of the more central and commonly used definitions. And the idea is that institutions are humanly devised constraints that shape human interaction. And Douglas North, who was an economist Nobel Prize winner, described institutions as the rules of the game. So they are the rules that govern the actions of individuals. And to then sort of conduct an analysis by institutions, then we are sort of trying to explore how those rules function. And those would include informal rules like the norms and the conventions that shape activities in a community or in a country. And they include formal rules like policies and regulations and legislations, etc. And it's important in thinking through rules in this way to think about who makes them, who changes them, who monitors them, and who enforces them. And people who are involved in these four sets of activities in governance. And they could be individuals, they could be groups, they could be governments, they could be actors in the market. And they are, of course, also in turn influenced by rules. So in other words, some people make rules, some people, the people who make rules are themselves influenced by rules. So it's a web of interconnections between people making rules and people being influenced by them and responding to them, etc. And you might reading so far, the first set of people to use an institutional framing to define governance were Brinkerhoff and Bossert, who defined governance in reference to the rules that distribute rules among actors and shield their interactions. Essentially, to govern is to make, change, monitor, or enforce rules. And I find that a very sort of useful way to sort of make governance more concrete in my head, is to ask the question, who is making the rules, who can change them in response to feedback, who is monitoring the implementation of the rules, who will be enforcing it, or are those things happening, and how are they happening. And so, like I mentioned earlier, this whole sort of framing of governance has been heavily influenced in the book of speech slide, but she's American. The woman and won the Nobel Prize in economics in 2009. And their definition of software, their framing of software, aligns very much with my thinking on what governance is in relation to rules, etc. But it's also important to then define what those rules do, or what they are expected to do. What are the outcomes of those rules? What are they for? And again, so here I'm adopting ideas from Avinash Dixit, who again is another economist. Like I'm sure you noticed that I have a huge crush, I suppose, on economics. Yeah. Hello. Hello.
There are connection problems. We can't hear you very well. There are cuts in the conversation, in your presentation.
Okay.
I don't know if you changed something with your microphone or.
Did it just change recently?
Yes, it changed now. For 2 or 3 minutes, there are cuts.
It was
your presentation.
Yes, it was the previous. Maybe you could come back to the previous slide and summarize it very quickly, and then go on. And we hope that things will. Okay.
Okay.
Yeah. Go ahead. Yes.
So the previous slide is a slide about software and hardware, and like I was saying, that this framing, which has been in place for about 5 or 6 years, from the paper by Kabir Sheikh and Lucy Gilson and etc., it is very much in line with the way in which I think about governance, which is the idea that governance is the thing that animates the building blocks, in the same way that software in this framing, I think, is the thing that animates the hardware and makes them function, and determines how they function, in fact. And so again, I was talking about, so what do institutions do? What are they for? And I think of that again influenced very much by the work of Webinar171124, and I was mentioning that Dixit himself is again another economist, and you might have noticed that I do have a huge economics envy, and some people have described it as a crush on economics, but I do appreciate their work very much because the economists tend to think perhaps more granularly about these sorts of issues. So institutions provide public goods. They are the things that determine how, the rules that determine in a society how collective resources are used to make public goods available. And in the health system, you can think of that in terms of training health workers, building health facilities, constructing roads, making sure information systems work, providing social safety nets, etc. And institutions also define and protect the rights of people in a community or society to the benefits that derive from those collective resources. Such as the right to use health facilities to access services, to co-manage the service, to even own such health services. And the third set of things that institutions do is that they sort of maximize the benefits from those resources by facilitating transactions, essentially by providing information, regulation, coordination in a system to ensure that, for example, people who need to use health services are able to access those services. And you can again think of this in terms of the universal health coverage cube, in the sense that if you think of the extent to which people are covered, if you think of the extent to which people have rights to such a coverage, if you think of the extent to which there are institutions in place to facilitate people's interaction with the health system, right? I find that the cube and the idea of universal health coverage helps me think perhaps also very clearly about what institutions are there to do. Now, so that said, another set of considerations is to then think of the levels, like I was describing earlier, the levels at which rules are made, monitored, changed, and enforced. And Ostrom's framework sort of identifies three different levels that sort of interrelate with one another in a sort of bi-directional sense. So there is the constitutional level of governance, where governments, and whether national or subnational, and government-like entities like international NGOs and large NGOs make rules from a distance, essentially. And there's the collective level of governance, often involving community groups, sort of informally, and sometimes also formally involving devolved, close to community levels of government. And there's the operational level, which involves the level at which people interact individually, actors in a market, in social relations, accessing services, or providing services. Now here is my version of it, which sort of lays out the three levels of governance and how they relate to one another. And you can sort of see that the constitutional level relates with the collective level in terms of legitimizing the existence of the collective level of governance, whether at the community level or at the very local district level. And when sort of communities as well sort of have this relationship with the government in terms of advocacy and demand for improved services, for example. And you also have the operational level of governance where providers and users interact. And with that as well, you have the government making rules and people there responding to those rules. And you also have the community making rules and people responding or not to those rules. Now, so there are three sets of two-way relationships here. And those sets of relationships can, of course, be thought of in the sense of the principal agent framing of things. So one level of governance, in certain circumstances, is the principal who is asking another level of governance to do things, and the other level responds or not, and one level provides incentives or rule systems or enforcement mechanisms to make sure that the other responds. So there are sort of three sets of those kind of relationships. Now, one of the things that I found interesting in my experience has been, for example, that there has been so much attention given to the relationship between the government and the operational level in governance, and in interventions to improve governance. For example, in performance-based financing initiatives, you'd often find that the connection that the initiative is trying to strengthen is actually the connection between the payer and the provider, and sort of providing incentives along that axis. But there are two different axes that are often ignored in thinking through how to intervene and improve governance relations, and that's that's the axis that I mentioned that often we pay a lot of attention to, justifiably, but we also ignore the other axis of interactions that are very important to making a system work. Now, so I often play around with the building blocks this way. Pardon my art, but what I was trying to do here is essentially to show that at the operational level, you could have all of this. So in other words, you could have a provider setting things up such that all of these building blocks are contained within the operational level. Of course, that's not often the case. Often the case is that the government provides the left side. So there's the yellow circle on the left side, provides financing, information supplies, health workers, and then at the operational level, you'd find health workers and, of course, at the service delivery interface with the people. But you could also find the left side boxes being provided by communities, and it's in my experience that in many instances, communities tend to also do that too. So you find that the institutions to provide these public goods, again, can derive from any of these three levels of governance. And to assume that they do not, to assume that only one level provides them, or only one level is expected to, or in our troubleshooting of health system problems, to assume that these other things do not happen, is to not be true to reality, no matter how dysfunctional that reality is. Now, I thought I'd put this slide on to show how different this is from the multi-level framework that I showed. Because they look quite similar, but they are different in that this particular framework sort of separates providers and clients / citizens. Whereas in the other framework, you actually have the interactions between providers and users at the operational level of governance. So these are levels of decision making, levels of choice making, and how they relate with one another, not so much accountability relations between or among individual stakeholders in the system. So that is what I, in my head, think of as part one of this talk. The second part is much shorter, and it's also in my further quest for a common set of language that we can use in thinking about governance. So the first part, I've tried to sort of bring governance down and sort of describe how the unit of analysis could be thought of in terms of rules. But for this second part, I'm trying to come to terms with the different ways in which the word governance has been used in the literature, the sort of things that it's been used in reference to analyzing. Sometimes it's used in the sense of a unit of analysis, and sometimes used in reference to, for example, the rules, like I described earlier, or in terms of who is doing the governing. So I've sort of tried to pass all of those very varied literature into these three different sets of ways in which it's been used. So the first is a government-centered sense, in which the unit of analysis is the government, often national, often taken as a whole, and often in a quantitative sense. The second set is in the sense of a building block of an organization, which could range in size from how the Ministry of Health functions within itself to how a health facility functions within itself. And the third sense is the sense that I have been describing all along, which is the sense of institutions, where the unit of analysis are the rules that govern relations among people. So here is further description of the different ways in which the word governance or governance has been framed and analyzed in literature. And the first two ways, sort of government-centered building blocks, are heavy on the hardware. Sometimes they include software considerations, but less common. Whereas the institutional framing of governance is heavy on the software side. Now, the government-centered sense, it's also very heavy on the normative sense. In sort of that's how often WHO, the World Bank, etc., would give a list of different ways, different principles of governance, and then often create a metric for comparing countries. And these are often used in regression analysis to sort of determine how governance influence a thing, but sort of treating governance as one whole bulk without opening up the black box. The building block sense, like I said earlier, is sort of thinking of governance in terms of how it works within an organization. And often the principal agent theory that I mentioned earlier, decision space approach, is often used. And the institutional sense of governance, like I said, governance is thought of and treated as a complex web of interrelations in which people make, change, monitor, and enforce rules, and are in turn influenced by those rules. Yeah, so again, the government-centered sense of governance is often used in ranking exercises, normative, typically quantitative, etc. And here I've put a table from the paper on which this talk is based, of how different organizations have broken down the different dimensions and principles of governance. And in the building block approach, it's governance treated as a building block, like I said, and often it's this sense in which principal and agent relations are sort of taken as the singular unit of analysis. And for those who love the building blocks, and I know there are people who love the building blocks, this is me holding out an olive branch, saying that the building blocks are not useless, they are useful. In fact, the framing of governance within the building blocks could be useful if your thinking is limited to how an organization functions within itself. And the third sense, which I've been talking about all along, is the sense of rules and different levels that we do operate. And I thought I'd give a few examples of some of the work that I've been involved in, which have been influenced and informed by this way of thinking about governance. And the first, I'll give it a quick snapshot of 3 different studies. So this first one sort of is trying to look at what are the consequences of the institutions to facilitate transactions not being present, right, in a system. And one way to measure that, and I was particularly interested in measuring the consequences of weak governance, was to try and assess the barriers, the cost consequences of the barriers to accessing services. And for this particular study, we used data from people with TB, and TB is particularly important or interesting here because it often has a particular treatment. If you are not accessing that treatment, you are not getting treated. It's chronic, which means that it's not self-limiting, which means that people who have it actually often have to access treatment. So then we followed data on individuals who finally made it to the point of care and tried to trace where the barriers that they experienced along the way and sort of costed that as a reflection or as a potential way of thinking about how to measure the consequences of weak governance and sort of disaggregate those consequences and think through how to intervene in such a system. And of course, like you might expect, you found people first accessing traditional providers or drug shops or formal providers who are not accredited to deliver TV services in that community, etc. So here the assumption is that the perfectly facilitated transaction will go from A to B, and that what we found, what in the case of most instances, how convoluted getting from A to B. And we also identified different socioeconomic contextual factors and geographical contextual factors, in addition to the institutions that were not present to facilitate those transactions. And the second study that I wanted to illustrate here was when we tried to study how primary health workers are posted and transferred in Nigeria. And one of the interesting things that we found was that, of course, there was no policy, which meant that the constitutional level of governance essentially was absent. And part of the theory behind the multi-level governance framework is the idea that when one level is absent or when one level is performing suboptimally, other levels rise to fill the space. Typically suboptimally, typically rather poorly, but you can sense that dynamic. And sometimes when you can't intervene at the level of government, you want to intervene at other levels to keep the system functioning. And here we found that at the very local levels of government, devolved government, and at the community level as well, so people operating at the collective level of governance, we are making a lot of the rules that determine how health workers are posted and transferred in different communities. And the third study that I would illustrate was one in which we try to look at how community health committees in Nigeria have tried to limit informal providers. Again, this is a setting where the government doesn't do very much to limit these providers, and perhaps the government cannot do very much to limit them. So again, we are thinking through how other levels of governance perform these roles. Again, in a way that would help inform how we think about intervening, right? So it's not just that we're thinking about different levels and perhaps condoning the fact that the government is functioning well, but that there are sometimes different levels at which we intervene. There are sometimes levels that are perhaps more efficient at which we intervene. And here we again identify different things that community groups were doing, again, suboptimally, typically, to limit the role of informal providers in their community. So again, I want to conclude by highlighting sort of three very key things that I've tried to highlight in terms of thinking more clearly about governance. The first is that there are three levels at which actors make, change, monitor, and enforce rules, governing the supply and demand of services. And these are the levels at which to analyze governance, and the levels at which you think about capacity to do things, so capacity to change and make and monitor and enforce rules, and the levels at which you think of the consequences of these rules. Again, the levels are constitutional, collective, and operational. The second set of three things are the sort of three sets of things that governance rules try to do, or that they do, which is that to determine the use of collective resources to provide public goods, to define and protect the rights of individuals and communities in those groups, and to facilitate appropriate transactions. The third set of three things that I try to highlight as well are the sort of three ways in which governance has been framed in literature, which is in terms of what governments do primarily, what happens within an organization, and what happens in terms of how rules determine the complex level of interactions among people. Now, I'll just cheat and mention another three sets of things, which I didn't talk about very much, but it's also important to have at the back of our mind, which are the sort of contextual factors that then determine who makes these rules and how they function, etc., which are sort of, again, institutional context, which has to do with the rules coming from a different level of governance. And then socioeconomic context, which has to do with sort of power relations and income and gender, etc. And the geographical context. For example, how large the communities, how remote the communities, or country, etc. And I'll stop there and hope that we can have a little bit of discussion and debate around these ideas that are put forward. Thank you very much for listening.